Hi gang, so today we're going to have a chat with Phil Tilley, who's a friend of mine from Monmouth Triathlon Club, and see you're sporting the Monmouth Triathlon Club hoodie. It's probably a bit remiss of me not to be wearing mine, but there we go. Anyway, Phil for years he was probably the butt of a lot of jokes for never having done an Ironman. And that's not to say he was lazy in any way, because he did a hell of a lot of half Ironmans and loads of other races as well. And if you wanted someone who's going to rip your legs off on a club ride, then Phil was probably your man and destroy everybody in the swimming pool. But 2018, he put all that to bed because he did Ironman Wales in the cracking time, and everybody just had to shut up then and give him the credit he deserved. But the reason we're chatting to Phil today is that obviously we've been raising some money for Prostate Cancer UK, and unfortunately Phil was diagnosed with prostate cancer a little while ago. And if it can happen to someone who's as fit and healthy as Phil was at that point, then it can pretty much happen to everybody. So we wanted to have a bit of a chat through Phil's story of how he's diagnosed and the treatment he's had and so on. And hopefully it'll go some way to encouraging other men to get themselves checked out, and also any women that are watching to pester men to get themselves checked, because I think often that's half the battle. I think us chaps are pretty rubbish at dealing with health issues as they come up. Be interested to see if there's any similarities with my dad's story, because obviously he's having some treatment at the moment. But yeah, Phil, how I guess the obvious first question is where did this all start for you?
Yeah, no, thanks, Gary. Yeah, I think you picked me up a little bit, but yeah, it's strange actually. I always considered exercise. I had quite a sort of a full-on, I guess, international career, doing an awful executive sort of like travel and everything else. And I felt the only way to actually keep ahead of myself was do a lot of running in the morning at 5 o'clock in the morning before then going into work meetings or sort of like 10 hours or something. And that sort of level of fitness sort of just built. And as I say, the reason I didn't do the Ironman, as you said, was simply because I just didn't find I could train hard enough to actually get the hours in training a week to do it. So as soon as I was able to take sort of some retirement and take some time off work, I was able to put in 15 hours training a week and then feel in a good state to do an Ironman.
Yeah, I think it is like having a second job, isn't it, training for one of them?
Yeah, absolutely. If you want to do like I do, it's like you wanted to do it justice. Everybody was saying you need to do it. Well, I didn't want to turn up and just do it. I wanted to do it justice, which is the way I've always done. So yeah, and I guess everybody sort of said, yeah, you know, fit guy. And then but then partly nag, but also this sort of like thing is saying, okay, well, I had the opportunity to have a wellness, one of these wellness checks, which was partly I felt, actually, everybody knows me as fit and healthy, but am I really fit and healthy? And I'd never really thought of going to the doctors. I thought about prostate to a certain extent, but in the back of my mind, but it was more the whole all-round thing is, am I really, healthy? And certainly, there's a little bit of history of heart problems in my family as well. So, right, okay, we'll have the whole full health check thing. Yeah. So I think I booked that last November and had it done in January and got the results back in February. And I got this wonderful report, full wellness report, and I think you can still see. I can still see the pink stickers of the 3 pages. There were sort of 3 red alerts in there. Turns out one of those was obviously the PSA, something I'd never thought about really. Wasn't expecting it to come back, but so coming back with.
You didn't have any symptoms or anything that prompted you to do that. It was just merely kind of a time for a bit of an MOT and see what's going on, kind of a.
Yeah, absolutely. And I thought the MOT, as you say, I thought, I'll do this, bit of a laugh, I'll blast through. I'm fit and healthy. I want to come. And I was even the joking with the guy that I was doing it. He said, look, I think I'm going to come sort of like hopefully top percentile on your fitness test and that sort of thing, which I was, but but yeah, it was like let's do the MOT and let's see. So absolutely no symptoms at all. It's like was I getting up exceptionally in the night to go to the toilet? Was I having problems? No, not I was aware of. So yeah, so to come up with a PSA at 25, which was quite high, was a little bit of a shock. But actually, even then, coming back with that PSA result being fairly high, wasn't really any alarm bells.
Yeah. So what would a normal PSA? Do you know what a normal PSA for someone your age would be?
Yeah, I think that normally it's sort of like, well, normally it should be less than 1, I believe. Sort of like anything up to 3 is no real alarm. Anything over 3, it starts ringing alarm bells. By all accounts. And one of the interesting things, obviously, having gone through the process now and realizing that actually I'm now having sort of like every 8 weekly sort of like blood tests, and you suddenly realize that actually all these concerns about a blood test and showing your PSA level seem to be, from what I can see, quite, the blood test seems to be very accurate. So I don't understand. In the back of my mind, I don't understand why I didn't think about it, or why people don't go and do it more often, right?
Yeah, I don't know. I think that maybe it is that age-old thing that men are just a bit rubbish at going and getting themselves checked out. I think women are far better at doing it and probably get things picked up a bit sooner than we do. But also, I guess there's no national screening program for prostate cancer, is there? And I think that might be something that in the PSA test, and certainly one of the things that can affect a PSA test as a triathlete is going out and riding your bike. That can put your figures higher. So I think it's worthwhile doing it. It's probably the best thing we have at the moment. But I think it's not like going off and having a mammogram, for example, or a cervical smear or something like that the ladies do, which is pretty conclusive. I think with a PSA there can be false positives. It's just kind of probably the start of the conversation, isn't it? If your figures are high, it could be one of several things, but it's just worth getting that test done so that at least you can have that conversation and maybe some further investigations if you need to.
Yeah, I think that's absolutely right. I think, it's like, don't be afraid to go and have the blood test, get that check done, and you say, ask for a PSA. Anybody over 50 can ask the doctor for a PSA test, and be prepared. And as you say, if the results come out high, well, that's not necessarily indicative of cancer, but it's the start of a conversation that leads you down a path of diagnosis. And certainly when I had that first conversation with the GP, having got this sort of high PSA count, it was like the local doctor was saying, well, okay, it's not really a problem. He was trying to put my nerves at rest. The consultant was a little bit more positive on what the process was and what the likely chances of me having cancer were. But he was obviously, I was then with a consultant, right?
Yeah, I think the consultants are seeing a lot of it all the time, aren't they? I think the GPs have got an awful lot on their plate and a lot of things they need to be able to deal with, and they can't possibly be a specialist in everything. I think the other thing you mentioned about a PSA test, anybody over the age of 50, correct, can have a PSA test, but you have to ask for it, I believe. It's not something that automatically you'll get sent for. Maybe some GP practices might be more proactive. I think anybody who has it, there's a strong family link as well with prostate cancer. I know that something I've kind of looked into in quite a bit of detail now, given my dad's situation. I think my risk now becomes 1 in 3 rather than 1 in 8. So if your dad, your brother, or your uncle has it, then that's when you really have that increased risk. So I was 40 Christmas before last, and my dad's consultant, because his is a very aggressive form, recommended I should have a PSA test every year. So I'm actually due to go, and I need to put my 2021 one now, because I remember doing it after Christmas last year, which was fine. And hopefully it's something that won't ever come back with any problems, but at least we've got a baseline. We've got something to compare to. So if in the future something's raised, then, like I say again, it's just that it might be something that needs to be looked into a bit more with a possible diagnosis at the end or not. But it is important to get that done. So you mentioned you saw a consultant then. Presumably there was that must have kind of, when you saw a consultant then, was that more tests, or was that how did it go from there?
No, I think, yeah, I mean, again, I think it's not the most dignified a process. I think once you have that blood test, that high PSA, the process, and it's fair enough, sort of be quite open. Obviously, the local GP, the first thing they do is, it's the digit test. So it's like, okay, lie on the bench, pull your knees up, and I'm going to stick my finger in.
Yeah.
I did that in the local doctor's surgery, and he said I can't feel anything. Just to add to the indignity of it, he actually had a local young female doctor with him and said, I can't feel anything, but I'd like my assistant here to also have a go as well. So so the doctor's surgery, I had two fingers up my backside individually.
Hopefully not in the waiting room.
No, not in the waiting room. No. I think once you just say, okay, it's going to happen, right? And you just get. But then, yeah. So then again, it was like another blood test. Then see the consultant, sort of like referred to the consultant, saw him within very quickly. I mean, the handover from time I saw the doctor to get to see the consultant was actually quite a short time. And you've got to bear in mind the timing of this as well. So this was March this year. So just at the start of people starting to sort of think and panic a little bit about social distancing and this, but no lockdown. So sort of March, I go into the local hospital in Neville Hall and see the consultant there. And again, that was another finger test, and he had a very blunt and blunt conversation. And that was very much, it's like, yeah, there is something there. I'm pretty sure there's something there. Let's take it to the next stage. And that was definitely a real shock for myself, and to take a double breath. And
a real kind of slap in the face, wasn't it?
Oh yeah, absolutely. It was like, yeah, oh God, do I believe him? Do I not believe him? I feel really well. I feel fit. I have no problems, no symptoms. Surely, the consultant, what he knows obviously something, but yeah. But
obviously, your family, how do they feel at this stage?
With my three daughters, sort of like all grown up, mature daughters in their 20s. It was, let's look at what this means. And I think they then did a lot of research themselves. They had to sort of rationalize it in their own mind, what this actually meant. And, and as I did as well. And I think, you get the diagnosis and then it's like, okay, well, where do I learn more? Tell me what's going on behind this. And I think that's where, prostate sort of, research comes in really handy. I think that once you start looking, there are some great sources of good information and insight, and you have to try and understand the background and then get a feel for what are the steps, what process are we going to go through.
Yeah, I think with my family, I think I had a good look at the Prostate Cancer UK website, and there's some really good information on there and some really good support. I'm hoping to have a bit of a chat with one of their specialist nurses as well, just to get some more information out for people. But I think for us, it was Dad's story is a bit different in that he 5 years before he was diagnosed, he had a PSA test that came back as absolutely normal. He then, shortly before he was diagnosed, started to have some pain in his hip, which for him is not that unusual because he played a lot of rugby, he was a PE teacher, did a lot of exercise, and he wore his hips out and had them both replaced before he was 50. He's now 71. When he had his hips replaced, he was told that at 15 years that they might have worn out again and he might well have to have them replaced. So he was kind of, when they did them at such a young age, said, look, these aren't going to see you out. You're going to have to have these redone at some point. So started to get some pain in his one hip, and I think it was the earlier one of the two that was done, and automatically assumed that, well, it's probably the hip joint wearing out again. At that stage, then he went for an X-ray. And it was found, as commonly happens with some of the more aggressive forms of prostate cancer, that it had spread to his bones. Particularly it spreads to the pelvis and the hip area, but it's in his other bones as well. So he's had some problems recently with some pain in his ribs and had to have some radiotherapy as a result of that, which has helped. But his had gone, in the space of 5 years, had gone from a PSA test saying everything's fine to this is something that we can't cure now. This is a case of having to manage it as best we can. So he's had various treatments, had some chemotherapy, some radiotherapy, and so on. But it's not something that's ever going to be cured. So that was a real punch in the guts for all of us. It's not you expect your dad to phone you up and tell you. We knew he was off to have an X-ray. We were just expecting, I don't know what you see if a hip joint is looking a bit worn out. Maybe it's a bit like a worn out tooth that I might see. You'd see a bit of space around it where it's getting loose in the bone or something like that. But it was absolutely clear that there was nothing else. And as soon as the X-ray results came back, it was a doctor phoned up, you want to go for a PSA test. And at that stage, we knew what was going on. So these things can happen. They can happen quite quickly. So, and we don't have a history of prostate cancer in our family. But then my grandfather on that side, he died younger than my dad is now. He was a smoker. He died of lung cancer. So it may have been that it may have been later on in life, if he'd lived longer, that we may have picked that up. But I don't think Dad didn't do anything wrong. He went for tests when he was asked to by his GP, and it had just gone too far by that stage. But luckily, it sounds like you feel that you were picked up a bit earlier than that, obviously.
I think that was a little earlier. Although it was an interesting one. That was one of the questions the consultant asked. Is like, have you had any back pain? And something that I guess you suddenly start thinking, well, my back has been quite sore at times. Was it linked? Was it not linked? I'll never, you don't know. But it was definitely something I'd never considered, that actually some back pain is commonly linked to prostate. And I think possibly slightly more advanced. But my diagnosis was sort of locally advanced. So by the time we'd gone through the diagnosis, it turns out it had gone beyond the prostate itself and has sort of leaked out into the lymph node. So it is but it's locally advanced, and hopefully with radiotherapy, I just had a month of radiotherapy. Now my PSA is back down at a consultant meeting on when was that, Thursday, and the PSA is down below 1. So the consultant is sort of quite pleased with the way the treatment has gone. So
you mentioned some radiotherapy. Have you had any other treatment at all?
No, it's just radiotherapy again. Discussion, discussion around surgery versus radiotherapy versus what drugs to go on, and COVID has thrown a few curveballs in that process. Especially with the drugs and sort of what drugs you normally go on. Obviously, I think right now in Wales, the decision is actually to put you onto, I went onto something called enzalutamide, which is quite an expensive drug. It's fair enough, it's an expensive drug because of COVID, and they don't want you anywhere near any hospitals. They want to put you on that drug and get you sorted quite quickly. It has, the research that's been done has shown that has a better outcome than some of the other more normal sort of historical prostate drugs.
Is that some kind of hormone treatment or?
Yes. So it's hormone treatment. So so the biggest impact is my power levels on the bike. There's no way I'd slaughter you now on the bike.
Well, you might do, because I haven't ridden my bike since April. But I'm pretty sure you still have me in a swimming pool if they were open, so we're not going to be able to test it.
I'm not even sure about that, but I've had to rationalise myself with all my strength and power is dropped down while I'm on the hormones. Effectively, the hormone treatment is again something that learned. The prostate cancer thrives on testosterone, so that's what it feeds on. So if you sort of suppress the testosterone, then you effectively suppress the cancer. If it's not spread outside the prostate, then surgery is an option. But because it had actually sort of got across into the lymph node, then radiotherapy was the prescribed sort of process, which was a month of radiotherapy again. Being fit through some extra challenges into that process as well, because normally I think apparently you normally got a little bit of fat around the prostate, which means radiotherapy, the bowels and the prostate are slightly separated by fat, but being fairly lean, they're a bit closer. So that's one of the dangers and risks of the of side effects of the radiotherapy can be impacting of the bowels. But getting into some of the nitty detail, but you know.
So did you feel okay during that during the radiotherapy?
I managed to train nearly every day. I wouldn't say I felt okay. In hindsight, you know, definitely off the coffee. So you couldn't go. There was no point going for a bike ride and a coffee stop if we could have done without, you know, without all the lockdown rules, because you know, I just couldn't handle caffeine. But apart from that, yeah, I did train lightly nearly every day and get through it. I wouldn't say it's not, but, yeah, so, yeah, fair enough. I mean, must admit the process, the NHS, the hospital were awesome in how they deal with it. I must admit. Yeah.
I'm not surprised you tried training every day, to be honest. I think mentally it's a big thing as well, isn't it? It's I think a lot of us use training as a way of getting through tough times, and I think some of the mental strain I've been under over the last year and a half or so with Dad, there's been times when I've just needed to go for a run, not because I need to train. Obviously, it's helpful in that, but just because it's a really good way of getting out and clearing the mind of some of the background noise, and helping to clarify things as well. I think there's nothing quite like going out for a run in the woods for me, like I did this morning. There's a lot of things that might be buzzing around at the start, but very often by the time you get to the end, it's all kind of evaporated and you're seeing things a bit more clearly. So I think I can entirely understand why you're doing treatment you do so. Hoping to have a chat with a chap called Kevin Webber as part of this series as well, who was a really fascinating chap. He was told 6.5 years ago he had 2 years to live because of advanced prostate cancer. Since then, he's become the only person ever with stage 4 prostate cancer to do the Marathon des Sables. And he's done it 4 times. The day after first round of chemotherapy, he went for a run. And when he went to his next consultant appointment, told his consultant that he'd signed up for the Brighton Marathon. I can only imagine what the consultant's face must have been like. But I think pretty early on he realised that he wasn't going to change this guy's mind. So I'm hoping to have a bit of a chat with him as well. So obviously you finished your radiotherapy now. What's the kind of process going forward? Is it just kind of regular testing and keeping an eye on it, or is there anything else?
Probably a couple more years on the drugs, so on the hormone treatment. So I still going to be down on power, but then for 2 years, and then every 8 weeks, sort of 3 months or something like that, having the tests, and just keep an eye on it for a couple of years. So I think they try and keep it suppressed for a couple of years and then wait and see what happens.
Fingers crossed that it all behaves itself and the drugs do what they need to do, and then you'll be back on the front of the pack, pulling the Tri Club round on club rides in no time at all, I'm sure.
Yeah, well, I think in the meantime, I'm going to have to find a new group of friends to normalise myself with and train with, right? So there's a lot of mental stuff. It's like I can't do what I used to do. Therefore, it's like, how do you get over that? So there's a little bit of that mental recalibrate your expectations of yourself. But hey,
I'm sure the Tri Club will be more than happy to have you along for rides, even if you're not tearing their legs off just at the moment.
I must admit, I think the one thing that's been absolutely unbelievable is the support from both the Tri Club friends, but broader range of people. I think that's the one thing that has been just unbelievable in this whole process, is the amount of support out there. In all sorts of places and sources is phenomenal, and I think prostate cancer research of this, it's been really one source of information, but the support. I've done various bits and pieces of charity stuff to raise some money, and that's been great as well. Linking in with Tenebus as well, and the chief executive there, Judah Rees at Tenebus, and she's been really supportive. So there's so much support out there, both from friends and online, right?
Yeah, excellent. So I think really the message that we need to get across is that just go and get yourself tested, isn't it?
No, absolutely. Don't just because you haven't got symptoms doesn't mean to say you shouldn't go and I guess ask her what's rightfully yours, right? It's like don't be worried about it. It's not a long process to go and have that test done. You know, the hardest part is picking the phone up to make the appointment.
And it's only a blood test. It takes a minute.
It's only a blood test.
Oh, and if you're clear, you
absolutely.
don't have to get the doctor and all their mates to come round and stick the finger up your bum either, do you? So
yeah, exactly. Yeah, exactly. I think on Monday, when I went in last Monday for a blood test, I was probably in the clinic, you know, in the surgery for less than 5 minutes. It was such a quick in-out blood test. And informally, the local GP gave me the answer informally within by Wednesday, right? So
excellent. Great. So thanks very much for your time this evening, Phil. That's been absolutely brilliant, and hopefully it just helped us to get that word out there and that message across. So I think a big part of the challenge that I'm doing is obviously the fundraising is really important, but if we can just get a few people to go and get themselves checked, and maybe they can pick things up before it gets to a stage where it is more advanced and treatment isn't going to be quite so successful, then that's obviously going to be great, and hopefully it just make more people think about it, and they might be they have a test now, and then because they've thought of it, then it prompts them to have another test in the future. So we hopefully might get a few people save their lives as a result of seeing this, which will obviously be the best thing.
Yeah, and you don't have to run up a mountain God knows how many times to not everybody has to run up a mountain to make sure the awareness is there, but it's good.
Brilliant. Well, thanks very much, and hopefully we'll see you in person soon.
Well, yeah, hopefully see you in person, and hopefully before you make your challenge attempt.
Yeah, that'd be good. Thanks very much.
Great. Cheers. Thanks a lot.
Bye.
Bye.